For the agent that must be in the know, Medicare Industry Insider discusses critical insight, noteworthy trends, and upcoming issues in the Medicare market.
Deciphering and debating the legislation, regulation, and what's happening in the market, I'm Jalen Jackson.
And I'm Rachel Bremeyer, and we're going to talk shop, dive deep into these complex topics, and make them understandable and actionable.
If you've ever wondered where the world of Medicare is going and how to prepare for the future, Medicare Industry Insider is the resource you've been looking for.
Welcome to another episode of Medicare Industry Insider. I'm Rachel Bremeyer.
And I'm Jalen Jackson.
And today we're actually going to discuss a discount program for medications called 340B. And it is very controversial in a couple different reasons. Essentially, 340B is a discount program designed for low-income individuals and uninsured individuals to help give them access to medications. It is a very, very large program. We're looking at $40 billion in annual discounts yearly. But there are some major challenges with this particular program.
Absolutely. So the 340B program historically has helped folks who attend certain pharmacies, primarily those attached to critical access hospitals or disproportionate share hospitals, to receive maintenance medications and other drugs at those serious discounts. But what we've seen happen over the past several years are some shifts, both with the PBM side, with the manufacturer side, as well as hospitals taking some new and perhaps unnecessarily liberal approaches with the program of how they apply it and who has access to those medications. So because of that, there is a lot of scrutiny over the program right now, a lot of legal action and legislative action going on regarding the 340B program. And unfortunately, as with most policy decisions, the people getting caught in the crossfire are your clients.
Yeah, so that's why it's very important to at least understand the program, know what's involved going on in lawsuits and what's going on in the government, and then also that the program is available to your clients if they need it. So that's the big takeaways throughout this podcast that we'll go over. But one of the big things that has been in the news recently is on November 30th, 2022, the 340B drug pricing program basically had a administrative dispute resolution notice. Basically looking a little bit deeper into this particular program and making sure it was actually doing what it was supposed to be doing, not overcharging, not offering it, basically digging a little bit deeper into what is this program actually doing and is it helping or are there people taking advantage of it?
Sure. Well, and really what they're trying to do with this administrative dispute resolution process is create a way to kind of keep a lot of this out of the court system. So the court system's not bogged down with long, drawn-out lawsuits. They wanted to come up with an administrative way to deal with these disputes because there's two sides of this. One system within the ADR process to deal with claims from covered entities, hospitals and pharmacies that claim they've been overcharged by a manufacturer. And then on the other side, claims by manufacturers that they've conducted audits and maybe they've found that there are, prohibited activities going on, such as diversions or duplicating discounts. So this ADR process that HHS created was really designed to kind of streamline this process of adjudicating these claims by covered entities or manufacturers without bogging down the court system, because it's been a major, major fight over the past few years.
Unfortunately, it's still bogging down the court system.
Absolutely,
we'll dive a little bit more into that. So if we're even just looking at the federal court systems, we listed off a ton of different court cases that were going on. But essentially, federally, there's quite a few lawsuits happening right now that you can actually dig into. Most of them going on along with, making sure that this program is doing what it was originally designed to do, which was help people who are on Medicare and Medicaid or who are maybe on that little cusp of low income and they can't quite afford those prescriptions. So it is interesting to see kind of all the different court cases. We ended up listing out several, like 5 or 6 different court cases that we were digging into.
Yeah, quite a few things going on. And like you said, this is a program that really helps those folks, that are, like we said, uninsured, or maybe they fall into that area where, they don't make enough money to live on, but they make too much to get any help. And that's really who this 340B program has been a major help to. But there's a lot of things going on in terms of manufacturers challenging some recent court decisions, drug manufacturers not being permitted to, quote, to impose unilateral extra statutory restrictions on its offer to sell 340B drugs to covered entities utilizing multiple contract pharmacy arrangements. This is in regard to one of the things we continue to see is these hospital pharmacies, these covered entities. It's not just hospitals. It's a number of other covered entities, but hospitals being one of the most common ones. They are authorized to buy these drugs at a significant discount from manufacturers. Manufacturers then enroll in the plan and agree to sell those drugs at those discounts. But what's happened over the past few years is these covered entities, hospitals and other types, will utilize contract pharmacies. Maybe it's a small rural hospital that doesn't really have an in-house public-facing pharmacy. They will contract with Joe's Pharmacy down on the corner. That'll be the contract pharmacy that then has access to the 340B program. But what we keep seeing is these covered entities may contract 9 pharmacies that are not actually located at the covered entity's location, and all 9 of those pharmacies are then being able to buy those drugs at a discount. And in some cases, the allegation is that they may be taking those discounted medications and they may not be going where they need to go, going to those low-income, uninsured folks. They may be getting sold to just anybody. And in turn, the pharmacies are getting full compensation on heavily discounted drugs.
Yeah, so we're definitely seeing that in the federal world. And then in addition to that, we can even dive a little bit deeper into all the state regulatory actions that are happening right now as well. And in fact, when we were looking, there's 11 states right now that have enacted protections for the 340B hospitals, community health centers, and public health clinics, basically looking for ways that they can kind of keep this 340B mainly doing what it's supposed to be doing. So in addition to that, we even found that at least 10 states prohibited the PBMs and other payers from denying the 340B pricing or contract pharmacies acting on their behalf. So basically making sure that pharmacies are not making more than they should be making, because like you said, they're getting paid their full price and they're offering these particular drugs at a discount. So we're definitely digging a lot into more local, state, federal action, or state actions as well as federal actions.
Well, and one of the big issues here that has arisen is since they couldn't get any kind of legislative or injunctive relief through the court system, a lot of these drug manufacturers started kind of taking things into their own hand. They would say, listen, we're changing our internal policy and we're only going to allow X number of contract pharmacies per covered entity. So if you have 9 contracted pharmacies, great, pick 2. That's all we'll sell to. Of course, certain law has said, well, that's not possible. That's, extra regulatory authority that you don't have. You agreed to sell at these prices to these entities, including their contract pharmacies. And again, we saw these 10 states that are even encouraging more protections, because again, whether or not these pharmacies are acting inappropriately is definitely up for debate. But to remove the 340B program from these contract pharmacies would undoubtedly remove access to affordable medications for some beneficiaries. So in addition to looking at what are the protections available for folks using the program, it really becomes a question of to what extent can these drug manufacturers just unilaterally take action as opposed to going through official channels?
Right. Something else that's kind of interesting is with 340B, there is no list. There's nowhere you can go and say, like, these are the pharmacies that are actually participating. So as a agent looking at your clients, having those conversations with them, if one of them brings up that they get these plans for or prescriptions for a discount, it's important to write that down and make sure that you're keeping a list of which pharmacies are participating and which ones are not. And drugs can fall off or be on the program as well. So even if a prescription is something that particular client uses, they could be going to the same pharmacy and maybe the next time they go, they're not getting that discounted price. So it's one of those things as an agent, knowing what is available and that this program exists, but also understand that it's very fluid.
Very fluid. The program's obviously at risk, as we've said. And I think another big thing to look at is just what other access do your clients have to cost assistance. So obviously, once folks age into Medicare, they lose access to a lot of the manufacturer rebate programs and other things like that.
Yeah, even like, we've seen a whole bunch of them, like GoodRx, CleverRx. There's a lot of different programs like that that, people can utilize, but once they go onto Part B, they no longer have access to those manufacturer discounts.
Yep. So manufacturer discounts, but really just be cautious of, anytime your clients mention paying for medication outside their insurance, not necessarily a bad thing, but just understand what they're up against. Make sure that they have alternative options, and maybe make sure that you're still considering that in plan selection when you meet with them every year.
Right.
Also take a look at some of the changes that are coming to federal programs like low income subsidy. Starting next year, we will have no more levels of LIS of extra help. It'll be a flat yes or a no up to 150% of the federal poverty level. It will make things drastically easier. That everyone will have quote unquote full LIS at 150% or less of the federal poverty level. Going to make it a lot easier to quote plans without having to worry about am I getting the exact right copay for these clients. Turns it into a yes or no question.
In addition to that, if they're using something that's not technically going on to their Part D, then you would need to also make sure, like, knowing when they're going to have that hit that gap or not. Again, that's not going to be an issue come 2025.
Sure.
But in the next year and a half, making sure that you have that conversation with them. If they're not utilizing their Part D, it's not going towards that coverage gap. So having those conversations, knowing which hospitals take 340B, not hospitals, pharmacy. Pharmacies are taking 340B, and what prescriptions are actually available on that is important. It's also a really nice networking tool as well if you're an agent of approaching those pharmacies and saying, hey, I heard you were taking care of XYZ, how many clients you have, and having that conversation with them and learning a little bit more about their participation in the 340B program as well.
Sure. And I think another aspect of this that is kind of the big boogeyman in the industry right now is PBMs, pharmacy benefit managers. And, obviously they're under an incredible amount of scrutiny right now, and that is not an exception when it comes to the 340B program. Some of their tactics of things like pharmacy clawbacks for not meeting sales quotas, or some of their other contracting measures to apply additional rebates, can result in millions, if not billions of dollars of potential savings being diverted away from 340B beneficiaries back to those PBMs. So that's just another aspect of the scrutiny that this program is facing. And honestly, it may be time for an overhaul. That's entirely possible. It's a program that's been around for quite a while and has done a lot of good for a lot of people. But in this world of, very multi-level systems to get people from a drug being manufactured to actually in their medicine cabinet, there's maybe some room for improvement. And I think that's definitely where we are headed with this, is potentially some changes to the program that will make it a little more transparent. That's the big word in the industry these days. Big word. And definitely something that I think is a goal for a lot of people that are taking a hard look at these programs.
Right. Yeah, we've definitely seen a lot of news and action in terms of PBMs, in terms of this particular program, transparency. We're even seeing that recently with Medicaid prescription drugs as well. And we'll continue to see scrutiny and additional deep dives into the prescription drug world. This is just one drop in the bucket of what the world looks like, and it's something to be aware of as an agent and know it may not exist forever, especially with the Inflation Reduction Act too being very involved in prescriptions. So we will see. It may be something that continues to provide discounts to our seniors. It may not. But in terms of what you need to take away from this, just knowing that it's one of those programs that has been through a lot of scrutiny. Some people are taking advantage of it and maybe making a bit more of a profit than they should be. And some people are definitely benefiting from it and getting discounts that they very much need and deserve.
Absolutely. I would say the big takeaway for agents is just be really aware of the pharmacies in your community that participate in this. Make sure your clients understand the program and how to use it appropriately, especially for those high cost medications. And then even if they are utilizing 340B or any other non-insurance mechanism to gain medications, make sure that you're not ignoring that medication when you're looking at plan selection in the fall. Definitely want to make sure that you're still leaving that individual covered for that drug, even if it is at a higher cost under their insurance. Want to make sure that they still have coverage to avoid complaints, to avoid out-of-pocket costs that may be astronomical for some of your clients. And then again, just networking with your local strategic partners, whether that's pharmacies or local charity programs, for those clients that may need a little extra help from time to time.
Yeah, so I think that basically wraps up this particular podcast. So I appreciate you all for tuning in to Medicare Industry Insider, and we'll catch you next time.